international heroes in ophthalmology, which was the cream de la cream in academics. This is the bread and butter session, so to say, of the day-to-day life of ophthalmic practices. So I'll start with my first talk, which is on staying ahead of challenges and achieving success in a changing environment. I have no financial interest in any of these topics that I talk about. So why do we talk about change and challenges, and what is challenging in today's environment and for those who are starting a practice? Well, first is that the technology is always changing. What you learn in the medical college becomes obsolete by the time you start in private practice, and then 5 years, 10 years, you have to continuously keep updating yourself. You have to learn the new technology as well as to invest in new technology. And with the increasing awareness through internet and social media, patients are also aware of the changing technology. Then the practice patterns are changing. Now there are lots of demands from the patients. They want consultations online, etc. People are forming various kinds of groups so that they can share the responsibilities. So the practice patterns are changing. Can you put on the timer, please? The patient profile is changing. We have a very demanding society. Their expectations are changing. And we also have changing lifestyles. So patients do not have that much time. They want to just quickly come in, and they want everything at the tip and do not want waiting periods, etc. And in general, the patience and the reverence is much lesser as compared to 20 years ago. And the medical profession has also changed. So now, earlier what was simply a very sacred relationship between the doctor and the patient and was generally valued is now a very complex relationship. There are lots of players, there are lots of problems to consider. There is the role of industry, marketing, insurance, third-party administrators, patients wanting 5-star service. There are so many regulations, and the government comes up with new regulations all the time. And there is always this threat looming for litigation. So often the lone doctors feel like they're faced by a lot of sharks in these forms, and it is very difficult to survive in the ocean with so many sharks around. The society is becoming very volatile. Patients become violent at the drop of a hat. So you have to be prepared for these kind of situations also. And dealing with patients is increasingly difficult, but it is a necessary art to master because we have to deal with patients day in and day out, and you don't know which of them may turn out to be irate. They want a 5-star quick one-stop service. What was earlier considered to be luxury, now it is seen as a necessity. You have to provide so many 5-star facilities in your practices, and they are easily dissatisfied. So when it comes to overcoming the challenge of patient satisfaction and the dissatisfied patients becoming aggressive, communication is the key. And these are the things that we must learn. Listen to the patients. Often irate patients are cooled down just if we give them a patient hearing. Appear to be friendly. Gone are the days when doctors could behave like standing on a very high pedestal and could talk down to their patients. Now we have to be friendly to them. We have to be open-minded. And the essential communication skills for any career, more so in the medical field, are that you should continuously get a feedback from your patients as to where you're going wrong. Always be very confident in whatever you are telling them so that they can also feel confident about whatever you're prescribing. And non-verbal communication also needs to be stressed on, because many a times your non-verbal communication gives a lot of reassurance to the patients that they may trust you. The practice patterns are changing. We have group practice, solo practices. Online consultations are becoming very common. There are many hospitals which actually have online consultations advertised on their websites. They have rate slabs for online consultations, but we must be very cautious about this because doctors have landed sometimes in problems because of telephonic consultations. So the key is that we must maintain a presence in the virtual world, and probably the online consultation is more to give information, further references, to give them a guide sort of a thing, rather than actually prescribing treatment, because that may have medico-legal implications. And always remember that there will be very different practice patterns in small cities versus big cities, so we have to practice according to the setup where we are practicing. Then when it comes to jobs, there are lots of jobs. The jobs do offer good salaries and perks, yet there is poor satisfaction. And to overcome this challenge, what new residents and fellows must focus on is that good surgical skill is the key. This is what will increase your employability. This is what will get you the best job wherever you may go. And we must learn to master these surgical skills as early as possible before we get into family responsibilities, because then we can travel wherever it is needed and master the best surgical skills. Gone are the days where patients would accept mediocre results. Today, surgical skills have to be perfected. And post-training, we must observe different kind of practice patterns so that we realize what is the kind of practice that is suitable to our needs and our personality. Not everybody is cut out to do a solo practice and be responsible for all the patients 24/7. I welcome Dr. Debashish Bhattacharya, and he'll be speaking on group practice. And be prepared to evolve as the challenges come and the changes come. The other problem is medical cost. Obviously, when we have so much of technology and invest so much in technology, then the costs of treatment also go high, and often the patients have a problem more with the hidden cost, like an iceberg. And to overcome this, transparency is the key. We must have transparent pricing, and the patients must know what they are paying for, and it must be rational. Nobody should feel like, they have been told something and then they are given something else. Also in India, we'll always have to learn to deal with such diverse expectations. On the one hand, there are patients who want like a 5-star hotel service, and then the vast majority of our patients are poor and they are treated in the charitable hospitals. And one thing that we must do is, as we evolve, then instead of letting the NGOs handle the charity work, it is a need of the hour for ophthalmologists to have their own charities, maybe a group of ophthalmologists in club, and contribute to charitable work as their time permits, once in a week or once in a month. The other thing that we need to focus on now is to have very good staff education and training, because with increasing patient expectations, you cannot provide all the service yourself. So we need to have well-trained staff who can handle the various needs of the patients, can give them explanations, can give them guidance, and we must learn to use them well. And for that, doctors inherently are not very good at delegating. We must learn to delegate work, build a good team, and keep the staff motivated, because your employees can be your biggest assets as well as your biggest problem if you do not manage them well. So if you keep your employees happy, they will keep your patients happy. Train them well, and the key test is how well does your clinic run when you are away. For example, when you're at the conference, how well can your staff and employees manage the clinic and keep the patients happy? So there'll always be changes and challenges with the changing times, and we must remember that it is not the strongest of the species or the most intelligent, but the one that are most responsive to change. The other problem that many of us face is the role of marketing. It's a controversial area. Is it against medical ethics? We have traditionally been told marketing is not for doctors, but we can't avoid it with the entry of corporates in healthcare. So we must focus on in-house marketing, the internet-based information, but never give false information. Marketing is not a dirty word any longer, but we have to be careful in the kind of marketing we do, and have a very dignified marketing. Doctors have always had the word-of-mouth marketing. It is still the best type, but it takes time. But this is the most worthwhile investment of your time, to have patients speak well of you. And changes that are closer home are that economic growth is now really happening in the small cities and towns. And because 70 to 80% of our specialists are concentrated in the big cities, the Tier 1 cities, so the opportunities obviously are increasing in these smaller cities, where the paying capacity of the patients is also increasing. And there are less ophthalmologists who are inclined to move here. The role of industry is important. They not only sponsor and shape opinions, but industry is now becoming opinion leaders. We have to exercise our own intelligence as to what technology we must take in, because ultimately it is the patients who have to pay for it. And in the Indian scenario, we must learn the bargaining, etc., and traditional patterns, and always provide value for money. So to conclude, we are living in what is, as a cliche, called exciting times. We have many choices. Choose whatever is best for you. There is space for every kind of practice. Do not feel pressured by what is the trend currently, and concentrate not just on CMEs, but on a complete professional development, because this is what will be very useful for your practice. Thank you.